I'm Dr. Linda Hermeller. I'm a board-certified endocrinologist at the St. Elizabeth Physicians Regional Diabetes Center.
I'm Dr. Brad Eilerman. I'm a board-certified endocrinologist at the St. Elizabeth Physicians Regional Diabetes Center. An endocrinologist is a physician who evaluates and treats disorders of hormones in the body. This includes diseases such as diabetes, thyroid disease, adrenal disease, and diseases of the pituitary.
Although it is, the main part of our name as the Regional Diabetes Center, we want to make sure that everyone knows that we do general endocrine care, very comprehensive endocrine care. So we take care of thyroid diseases, we take care of adrenal and pituitary diseases, and metabolic bone disease like osteoporosis or calcium disorders. There are so many conditions that fall under the umbrella of endocrinology that unfortunately patients do get a little confused sometimes why they're coming to a diabetes center, but we do take care of all of those conditions.
One really valuable part of our center is that our nurses are trained in endocrinology. So not only are you getting physicians that have training, you're also getting a staff that is very well trained in the kind of questions and the appropriate steps to take when a patient has problems going forward. So a phone call to the center doesn't get just a message of, I'll get the physician on that. It gets targeted questions that help you get to the bottom of what's going on. And that saves time and it improves quality.
We have a very large group of certified diabetic educators. These are either nurse educators or dietitians. Our nurse educators the majority of them are certified pump trainers, so for our patients who are on insulin pump therapy, we have all that training here in our center. They also are able to teach patients how to manage their diabetes. There's lots of skills and technical things that are required. And for our patients who don't have diabetes, we have a large number of patients actually who are seen in our center for weight management. So our dietitians are key for them to reach their weight loss goals, to come up with diet plans and healthy eating habits. We like to think that the St. Elizabeth Physicians Regional Diabetes Center is really a one-stop shop for our patients. When we were designing the center, we wanted to have as many services available for our patients in one location as we could possibly do. Dealing with a chronic illness, particularly diabetes, you've got to see lots of different doctors and you may need other specialists. We wanted to provide as much in one location as possible, and I think we do that extremely well here at the Covington location.
I think people should choose our center because of the comprehensive nature of the care that we deliver here. I think from the moment you hit the door, you're hitting people that are experts in endocrine care, people who understand the ups and the downs, people who understand the lifelong challenges of having diseases like diabetes, thyroid disease, and you're going to get people that know how to meet your individual needs. And I think our center does that better than any other center.
I chose endocrinology for my field of practice because I feel like it's detective work. Hormones in the body can be made in excess, or sometimes they're too low. And once we discover what the problem is, we can treat it. And it can be very rewarding both for the patient and for the physician. I really like helping patients feel better, and it's nice to be challenged and to play detective every once in a while.
I agree with Dr. Hermeller 100%. I really enjoy the problem-solving aspect. I also like the fact that we get to build relationships over time. Many of the diseases we treat are chronic diseases, and so over time we get to understand our patients' ups and downs and help them through the hard parts, but also celebrate their victories, and I find that very rewarding.